Unless you've been living under a rock or you don't have Instagram, you've probably heard about this newest trend called the fox eye lift, or also known as the cat eye lift. Bella Hadid has it, Kendall Jenner has it, and it looks like most of Hollywood is starting to get it too. I'm Dr. Wix-Harris, and I'm a cosmetic physician here at Reflection Center in Martinsville, and I perform the thread lifts. And today I'm going to talk to you about the fox eye lift and let you know what I think about it and whether or not you should do it. So this treatment is lifting the outside of the eye and brow to change the shape in more of a slanted look. The trend started in Russia, and they use all kinds of threads there in Europe, but over here at Reflections we only use the mint threads for it, and those are FDA approved, which means they have been through rigorous studies and they have been proven to be safe and effective, meaning that they do what they say that they will do. So lateral brow lifts have actually been pretty common in plastic surgery. A lateral brow lift means that we only lift the outer 1/3 part of the brow, which is the area that starts to drop the fastest as we age. So by lifting that, it's a really natural way to turn back the clock. Now, why are young supermodels doing this? It's just a trend at the moment. They're just using the threads to temporarily pull up the edge of the eye and the brow and to create a new, beautiful, trendy eye shape. We usually charge about $1,200 to $1,500 for the brow lift or the cat eye look. It depends on how many threads you need to achieve your results. We do offer financing, and I'll have a link below that has some more information about that. So I do think that the fox eye can be a very beautiful look on the right woman. To know if you are a candidate for it, if this would be the right way for you, or if you want to talk about just a regular brow lift, I invite you to come to our office for a free consultation. If you want to know a little bit more about the mint thread lifts, I'll include some information at the bottom of this video, including a video that goes a little bit deeper into what the actual procedure is like.